And it seems like you can, on one hand, be quite hard and have lockdowns, on the other hand, be more flexible, which is, and also ask more a voluntary social distancing and accepting isolation of the elderly, while, for example, maintaining kindergarten and primary school opens, which I think has been good, and it's also made the children being able to live a relatively normal life rather than to be locked up.
All right, but let's look at the numbers. Vox flagging statistics that came out showing that the death rate in Sweden is on track to be higher than that of the United States and much higher to any of its Scandinavian neighbors. Was it worth it, this strategy?
Well, I think these death figures are of course very difficult to compare. We know that death registration is done differently in different countries. It all depends who you compare with. Obviously, our neighboring countries have been better and more successful, which doesn't mean that is the lockdown that, for example, both Belgium and France have higher death rates than Sweden. So for me, I cannot see the real parallel between a lockdown and lower death rates. And here we're looking on a very difficult virus. We don't exactly know what the effects are. So I think we have to be very careful in interpreting these figures. And I think main explanation for these high death rates in Sweden has been the unfortunate that the virus has gotten into old people's home nursings. We have between 80 to 90,000 old, very vulnerable people that normally, when they enter into these homes, don't have much more than 1 year to live in average before the COVID. And now the virus, when it enters into these old people's home, of course, it has a horrible effect, and a lot of them die. But on the other hand, those people could not have been saved with healthcare because they're simply too vulnerable.
Now you can say you count deaths in a slightly different way, but if anything, Sweden counts deaths lower than, for instance, Norway, because Sweden only counts deaths when it has been confirmed by a test that the person who died had COVID-19. So today, Sweden has 6.5 times more deaths per million inhabitants than Finland, 6 times more than Norway, and 3 times more than Denmark and Germany, by the way. So,
and was it worth it, this gamble? The idea being that now more of the population might be immune.
Absolutely, it's that's another issue. There are many issues here. This herd immunity thing. I mean, there are now the antibody testing is just now really starting. And what we are finding is that there's nowhere near herd immunity, but what it is clusters. And the clusters are concentrated and explosive. But if you look, and this is stuff that is not yet published, in some countries it is, but in Sweden it's not yet. When you look broadly in the Stockholm community, you do not find a high rate of infection at all, but you find these clusters. Like in a hospital or in the old age homes, we're nowhere near herd immunity. And if we are trying to get herd immunity, we're going to have a devastation in this society.